Okay, so today we are going to show positioning on an AP supine abdomen, but a T-shot. Most radiologists want diaphragm and pubic symphysis on an AP supine abdomen, and on most adults, in order to achieve that, it requires 2 image receptors. One to capture pubic symphysis, the other one to capture diaphragm. But if the patient's body habitus is not hyperstenic, then you could, in theory, put one lengthwise and then one across the top, and that's where we get that name of a T-shot. So in the video, my patient is already changed. We've already done history. This is simply positioning. So we are going to go ahead and set the control panel for an AP supine abdomen. So we're going to choose abdomen, AP, and then we are going to use 80 kVp at 10 Mass. And it is in the table bucky at 40-inch SID. So I will get my patient in a minute. I will run my IR. All right, so we are gonna get this up to 40. And we are gonna get this out of the way so that my patient does not smack her head. And we are gonna put this in the bucky. Bring this down a little bit for her to sit. That is the nice thing about a high-low table. Not all tables vertically adjust, so if it doesn't, you might have to, depending on the patient's height, use a step stool or something for the patient. A lot of tables have it built in so that we're not risking the patient's safety by putting them on something that could potentially move. So we'll let my patient come in here and we'll let you lie up there on your back for me. So she would already be changed. She would literally have nothing on from pretty much ankles up. So top, bra, pants, everything off. Underwear typically is off unless there's nothing metal, snaps, button, zipper. If there's nothing on it, then they can leave those on. And then they would have a gown on open to the back. So we are going to raise this up first. And the table will stop at a 40-inch SID. And then it could go beyond that, but I don't need it to. So I'm gonna turn this on. And first thing I want to do is line up my bucky. So this is aligned, meaning it's in line from top to bottom with the bucky. I can tell by that laser light. I need to make sure I'm in detent, which means that I'm aligned from side to side with the bucky and the IR. And then my image receptor is in there currently as 14 by 17 lengthwise, meaning the long axis of the IR is going to go with the long axis of the patient. So I change this on the 40-inch collimator markings to 17 long and 14 from side to side. I just want to make sure my patient is straight. Anytime you have a patient on the table, which she is, you can relax your feet. And then we're going to go ahead and have her. Central ray on a supine abdomen. If it was one image receptor, it's typically at iliac crest and midline. But since most abdomen images are going to have to be 2. Usually what we do is just do the bottom image to include the pubic symphysis and then do another image at the top that will have overlap. So this bottom one I need to be in the middle. So my finger is on her xiphoid and I'm centered down the center of her. I'm going to just palpate where iliac crests are. And if you notice, I'm using both hands because sometimes when you just do this, you kind of poke the patient. So if you push on both sides equally, her crests are here, but I'm also going to just check and see where her greater trochanter is, just to make sure that I have pubic symphysis. So her greater trochanter is literally right here. And I know that my light field is slightly deceptive So I'm just gonna move this up a little bit. And just to see, I am pretty close because iliac crest is right here, but I'm gonna leave it because I just wanna make sure that I have pubic symphysis on there, and I know that I'm gonna have to do a cross image of the top of her anyway. So I'm lined up here. I'm at a 40-inch SID. I'm in detent, and I'm gonna put my left marker in the lower left portion of the image receptor. And then I'm gonna tell my patient. You'll notice there's no shielding. On a female, you cannot shield because the gonads lie in the area of interest. So we don't usually do shielding anyway, but definitely not on a supine abdomen on a female. All right, just make sure her hands are not underneath her. Good. And then what I'm gonna have you do is when I tell you, I'm gonna have you take in a deep breath and then blow it all out and hold it out, okay? Okay, go ahead, take in a deep breath for me. Blow that breath all out. Good, hold it out. Beep, you can breathe. Notice when I'm back here, one, I was breathing with my patient to make sure she had time to do what I was telling her. And also, an important factor is to look through the window and look at your patient. And I'm looking for her abdomen or chest to rise when she's breathing in and lower when she's breathing out. That way I know that the patient is able to follow the directions that I gave her. And that's the purpose of the window, so that you can always watch your patient. Now, when I take this marker off, we know that we have to overlap at least 1 to 2 inches of where we imaged. So I am gonna put my marker on her because I know I don't need a whole lot to get her diaphragm. I'm gonna put it this way. So I'm gonna have 2 inches of overlap. So I moved my marker. I'm going to then change my collimation to crosswise. I'm gonna leave my marker there for a second, and I'm gonna change my image receptor to be crosswise. And then I'm gonna move my patient so that I have the bottom of the light field is going to include my marker and also include her diaphragm. So I need to make sure I'm still midline, and then this much is gonna be overlapped on both images. That's not her left side. Since I am over on that, I am going to collimate just a little bit from side to side, and then I am gonna put my marker on my patient like that so that it'll show. All right, same breathing for me if you would. Go ahead, take in a deep breath. Blow that breath all out. Good, hold it out, don't breathe. Beep, good, you may breathe and relax. And that ensures that we get overlap on that so that we get pubic symphysis in the first image, diaphragm in the second image, and that way the radiologist knows that we've overlapped that area so there's nothing that can be missed. And typically most adults do require 2 image receptors, either 2 crosswise or that T-shot like we just demonstrated. So I move that so my patient can get up. Hang on, ma'am. Patients are always anxious to get up. And then we'll bring your feet over. Good, and then I would walk her back to the dressing room and let her get changed and tell her when the radiologist would read that and send the report, and then I would walk her out, and that's AP supine abdomen.